Have you ever wondered what happens to a medicine after you swallow it? How does a tiny tablet know where to go? Why do some medicines work within minutes while others take hours? And why do doctors tell you to take some medicines with food, but others on an empty stomach? The answers lie in a fascinating branch of pharmacology called pharmacokinetics. Pharmacokinetics is often summarized by just 4 letters: A, D, M, and E: absorption, distribution, metabolism, and excretion. Together, these 4 processes determine how a drug enters your body, where it travels, how it is changed, and how it finally leaves your body. By the end of this video, you'll understand pharmacokinetics in a simple way that you'll never forget. Let's get started. Pharmacokinetics is the study of what the body does to a drug after it is administered. It describes the journey of a drug from the moment it enters the body until it is completely eliminated. Think of it as following a package through a delivery service, from the warehouse to your doorstep, and finally to disposal. The 4 major stages are absorption, distribution, metabolism, and excretion. Together, they are often abbreviated as ADME. Let's explore each step. Absorption is the process by which a drug moves from its site of administration into the bloodstream. For medicines taken by mouth, this usually happens in the small intestine, where the large surface area allows efficient absorption. Once absorbed, the drug enters the blood and begins traveling throughout the body. Several factors affect absorption. Route of administration. Medicines can be given by mouth, by injection, under the tongue, through the skin, by inhalation, or into the rectum. Each route has a different speed of absorption. Blood flow. Areas with a rich blood supply absorb drugs more quickly. Drug formulation. Liquids are often absorbed faster than tablets, while extended-release tablets are designed to release medicines slowly over time. Food. Some medicines are better absorbed with food, while others should be taken on an empty stomach. That's why it's important to follow the instructions provided with your medication. After entering the bloodstream, the drug must reach the tissues where it is needed. This process is called distribution. The bloodstream acts like a highway, transporting the drug throughout the body. However, drugs are not distributed equally to every organ. Some organs receive more blood flow than others. For example, the brain, liver, kidneys, and heart receive large amounts of blood and are reached quickly by many drugs. Some drugs also bind to proteins in the blood, especially albumin. Only the unbound, or free, drug can leave the bloodstream and produce its effects. Another important barrier is the blood-brain barrier, which protects the brain from many harmful substances. Only certain drugs can cross this barrier. Metabolism is the process by which the body chemically changes a drug. The liver is the main organ responsible for drug metabolism. Special enzymes, particularly the cytochrome P450 enzyme system, convert drugs into forms that are easier for the body to eliminate. Some drugs become inactive after metabolism. Others become more active. In fact, certain medicines are called prodrugs because they are inactive when taken and only become active after being metabolized by the liver. Metabolism usually occurs in 2 phases. Phase 1 reactions include oxidation, reduction, and hydrolysis. These reactions often make the drug more chemically reactive. Phase 2 reactions. In this phase, the drug is joined with another molecule in a process called conjugation. This usually makes the drug more water-soluble, allowing it to be eliminated more easily. The rate of metabolism varies from person to person. It can be affected by age, genetics, liver disease, smoking, alcohol use, and other medications. This is one reason why the same drug dose may not work the same way for everyone. Excretion is the removal of drugs and their metabolites from the body. The kidneys are the primary organs responsible for excretion. They filter the blood and remove waste products into the urine. However, drugs can also leave the body through bile and feces, sweat, saliva, tears, breast milk, and exhaled air, especially gases used during anesthesia. If the kidneys are not functioning properly, drugs may accumulate in the body and increase the risk of side effects or toxicity. For this reason, people with kidney disease often require lower drug doses or longer dosing intervals. Another important pharmacokinetic concept is half-life. Half-life is the time it takes for the amount of a drug in the bloodstream to decrease by half. For example, if there are 100 milligrams of a drug in the body and its half-life is 6 hours, only about 50 milligrams will remain after 6 hours. After another 6 hours, about 25 milligrams will remain. Half-life helps healthcare professionals decide how often a medicine should be taken, when steady-state levels are reached, and how long a drug remains in the body after it is stopped. Understanding pharmacokinetics helps healthcare professionals choose the right dose, decide how often a drug should be taken, prevent harmful drug interactions, reduce side effects, adjust doses in patients with liver or kidney disease, and improve treatment effectiveness. This knowledge is essential for doctors, nurses, pharmacists, and anyone involved in patient care. Let's recap the journey of a drug. A. Absorption. The drug enters the bloodstream. D. Distribution. The drug travels to different tissues and organs. M. Metabolism. The body, mainly the liver, chemically changes the drug. E. Excretion. The kidneys and other organs remove the drug from the body. Remember this simple acronym, ADME. It summarizes the entire journey of a drug through the human body. Pharmacokinetics explains why medicines don't all work the same way in every person. From absorption to excretion, each step influences how effective and safe a medication will be. If you enjoyed this explanation, please like this video, subscribe to Williams Health Tips, and turn on the notification bell so you never miss our weekly health education videos. Thank you for watching. Be empowered to resist.